In this video, I'm going to try and answer the question, does it matter if your LDL cholesterol, your so-called bad cholesterol, gets higher as a result of doing a ketogenic diet or intermittent fasting? Does it matter? What should you do? Should you quit the diet, quit fasting? Should you start a medication? Should you do something else? So in order to do that, I'm going to compare a couple common scenarios. So one scenario, which is kind of the traditional high cholesterol person who has a heart attack or something, and compare that with someone who's on keto or doing fasting and kind of look at what's similar and what's different. I'll explain a few basics about cholesterol and then what some of the rationale as well as the evidence is to answer this question of whether you should change your approach as if your LDL gets higher while you're doing keto or fasting. So first, let's compare a couple of scenarios to kind of help illustrate these points. So the first is kind of the typical scenario you'd think of with somebody having a heart attack, having high cholesterol. So let's say somebody who's like 55 years old, we'll call him Frank, 55-year-old guy. He eats the standard American diet, so lots of sugar and starch. He smokes. When he's 55, he has a heart attack. So after he has the heart attack, luckily he survives, but after he has the heart attack, they measure his cholesterol and they say, oh, your LDL cholesterol is high and you had a heart attack. So for either or both of those reasons, we're going to put you on a statin medication like Lipitor, atorvastatin, to use one common example. So we're going to put you on that statin medication, lower your cholesterol. And so the reason we're doing this is because we think that that will lower your risk of getting another heart attack or other related heart problems down the road, that it will have at least a small decrease in your risk of that. Now, whether it actually does have a significant decrease, that's kind of open for debate because you'd have to go back and look at the original research studies, which are a little bit questionable in some ways. But let's just take that as scenario number one. Scenario number two is someone who is also 55. Their name also happens to be Frank. And in their case, they haven't had a heart attack yet, but they decide to do a ketogenic diet because they're overweight and they have high blood pressure and they have type 2 diabetes. So they do a ketogenic diet and they do some intermittent fasting. And as a result of all this, their blood sugar gets better, their blood pressure gets better, they put their diabetes in remission, they reduce their body fat a whole bunch, they lose some weight, they fix their blood pressure, it goes away, they don't need to be on blood pressure medications anymore. Oh, but when they went to the doctor, they checked their blood, they checked their cholesterol levels, and their LDL cholesterol, that so-called bad cholesterol, is higher. And so the doctor maybe says, oh, you better stop that ketogenic diet because your cholesterol is high, or you better take this medication to lower your cholesterol. Well, can you really compare that second scenario to the first scenario that I gave you? Here's what's similar between the two. They both have high cholesterol, including high LDL cholesterol. Here's what's different. The first person is on the standard American diet, sugar, starch. They also smoke. They had a heart attack. The second person is not on the standard American diet. They're not eating a lot of sugar or starch, and they don't smoke, and they already lost weight. They got rid of their high blood pressure. They had all these positive improvements, but the one thing that maybe would be looked at as a negative is having this higher LDL cholesterol. So can we compare them? Should these two people be treated equally? And, do they have the same amount of risk for having a heart attack? Does that second person have a higher risk of having a heart attack because of the high LDL cholesterol? So in the remaining portion of this video, I'm going to share some rationale as well as some evidence to kind of help answer that question more conclusively. But you can probably already draw some conclusions based on the way that I explained it so far. All right, so a few cholesterol basics. So when you get your lipid panel at the doctor, like I used to do when I did family practice, they'll measure your total cholesterol and then divide that up into what's called LDL, low density lipoprotein, and HDL, the high density. And then the LDL is nicknamed bad cholesterol, and the HDL is nicknamed good cholesterol. So generally speaking, your doctor wants to see your LDL be lower and your HDL be higher. They also measure what's called triglycerides, which is kind of just the type of fat that is getting carried around in your bloodstream the most. So that's what they look at. And if your LDL is high, they often say, oh, we should probably do something about this, like putting you on a statin medication. So that's just the really basic, because there's some weak evidence that maybe having higher LDL could increase risk of heart disease in general, but it's quite weak evidence. And when you put it in a different context, things change a lot. So the first step I'm going to do to try to further clarify this question and give you some evidence and so forth is I'm going to quote Dr. Ken Ford. So he was on my podcast a few episodes ago. I think it's number 51. And when I asked him about keto and heart disease, with the higher LDL and so forth, here's what he had to say about that.
Now, it's well known and has been known way before this conference paper that a ketogenic diet can increase LDL levels in somewhere between 20 and 30% of the people that do it. So this is a known phenomena. And it's important to note, unlike that first sentence you read, an elevation of LDL caused by a dietary change is not a strong predictor of heart disease at all. And it certainly doesn't double the risk, as the paper said. That's just absolute nonsense. There are a lot of other things besides LDL that change. So you typically see a significant increase in HDL. You typically see lower triglycerides. And most importantly, you see a change in the particle size of LDL. LDL by itself tells you almost nothing unless it's like 600 or something. And then you have an actual disease. You have an inherited genetic disorder. But for the vast majority of people, LDL is meaningless without knowing particle size and particle count.
So as Dr. Ford explained there, if your LDL goes up because you go onto a ketogenic diet or change the way you're eating, in other words, that is not a strong predictor of heart disease. And as he alluded to, LDL alone is pretty useless. You need more information than just what the level is of your LDL cholesterol, like the particle size and the particle number, which, 5-10 years ago, it was not at all common practice to measure those things. Now maybe it's becoming a little bit more common practice as well. And so whenever you ask the question of whether high LDL matters, whether you need to be on a medication, the elephant in the room, the bigger kind of question that is at the foundation of that is having high LDL even a significant risk factor for heart disease? And the answer is, So when we talk about that, it kind of goes back to the history goes back to the 1950s, which I've talked about on a couple podcast episodes. But basically that whole history about how they kind of jumped on the idea, maybe it's the saturated fat that's causing all the heart attacks, and it ignored things like smoking and other things like sugar that could be contributing to it. And then even though that idea wasn't based on good evidence then, and it's not based on good evidence now, it still has persisted in the medical field and in our cultural consciousness to the present day. So next, what I'm going to share next is, if LDL is not that good of a predictor of heart disease risk, what are some good predictors of heart disease risk that are kind of a replacement for that or something better to look at? Well, the first answer to that question is, on your lipid panel, there's something that's a pretty good predictor of heart disease risk, and that is your triglyceride to HDL ratio. So the triglycerides divided by the HDL. So for example, if your triglycerides were 100 and your HDL was 50, the 100 divided by 50 would be 2. So your triglyceride to HDL ratio would be 2. And the reason I've chosen the number 2 is because that's about where you want it. You want it 2 or below to have a good triglyceride to HDL ratio. So this ratio was cited in a paper where Dr. Ben Bickman, Dr. David Diamond, and Dr. Paul Mason put this together and did kind of an analysis of, I'm going to pull it up here so I can read the title to you, of whether it makes sense to be on a statin if you're on a low-carb diet and have high LDL. And the title of the paper kind of gives away their conclusion. It says, statin therapy is not warranted for a person with high LDL cholesterol on a low-carbohydrate diet. So this is pretty recent, October 2022, less than a year ago. And so, of course, I'd encourage you to read the whole paper. But when you read the summary of it, at the end of the summary, it says, our review of the literature indicates that statin therapy for both primary and secondary prevention of cardiovascular disease is not warranted for individuals on a low-carb diet with elevated LDL-C who have achieved a low triglyceride to HDL ratio. So there's that triglyceride to HDL ratio again. And they cite it as a better predictor of heart disease, basically by saying if you have a low triglyceride to HDL ratio, you don't need to worry about your LDL-C level if you're on a ketogenic diet. So those are some better predictors of heart disease from the lipid panel, or that's one rather. And some other better predictors of heart disease, better than LDL-C, are blood sugar, diabetes, insulin resistance, which is all kind of closely related, blood pressure, obesity, and smoking. So when you do things like fasting and keto, you often improve all of those risk factors, except for the smoking. So if as long as you also quit smoking, then you've improved probably the biggest risk factors for heart disease, other than age and family history, which you can't really change. You've probably improved the biggest risk factors for heart disease. And so if your LDL-C goes up a little bit, big whoop-de-doo. Probably doesn't matter. You're probably getting a net benefit either way. So most of what I've shared is kind of more about keto than fasting, but when you do intermittent fasting or extended fasting, your LDL often will be higher, at least while you're doing the fasting. So does that matter if your LDL gets higher in that context? And I think the answer to that is no one has done the research to answer that question, because all the research that kind of suggested that high LDL might be a risk factor for heart disease was not done and wasn't people that were doing an extended fast, right? It was in a different context. But my intuition says that's not a problem. In fact, it's probably a very normal and natural thing, because when your LDL goes up, it's kind of reflects that you're mobilizing more fat in your body, which of course you do while you're fasting, and you sometimes do that on a ketogenic diet as well. So the person who's doing the fasting and lowers all those other cardiovascular risk factors like the blood pressure, blood sugar, obesity, and other things that we can measure in your blood, like your CRP, which is a sign of inflammation in your body. If all those things are getting better, then it's pretty clear you're getting a net benefit from doing the fasting, versus, that possibly one considered negative thing of having the higher LDL. All right, so now for some big picture takeaways. So putting this all together, does it matter if your LDL gets higher on keto or while doing fasting? So overall, I would say it's a normal, natural process for that to happen. You're probably getting a bunch of health benefits from keto and or fasting, and those health benefits probably strongly outweigh or completely outweigh the potential downside of having the higher LDL cholesterol. An interesting anecdote, back in 2020, I was at a conference and talked to Dr. Nader Ali, who's a cardiologist who often talks about the benefits of keto and fasting, but he used to be, I think, an interventional cardiologist, so he was going in and opening up people's arteries and stuff. And I asked him, well, what do you think about this fact that, the LDL might be higher while you're doing an extended fast? And, is that a problem and so forth? And he said, I would view it as a beautiful thing that the body's able to do that while you're fasting, basically. So he was kind of talking about the wonder of the human body and how it's able to adapt to different circumstances. So traditionally we kind of look at it as a bad thing to have that high LDL, but it's a completely different context. So your body's adapting to a completely different circumstance. And so we really can't compare it. We can't look at it the same as we would in a different context. So to suggest that somebody should quit fasting or quit keto just because they have high LDL while they're getting all these other positive benefits and improving all these other cardiovascular risk factors, does that sound like common sense? No, it's the complete opposite. It's insanity. And so what do I personally do about high LDL during fasting? I don't even know if my LDL is high when I'm fasting because I don't measure it, because I just don't think LDL is very important. So don't really worry about that. I pay attention to things like my body fat and my blood sugar, which are much more important measures of my health than my LDL level. So speaking of those interviews I did with Dr. Bickman and Dr. Ford, here's the full interview with Dr. Bickman where we cover a lot of things related to insulin resistance and cardiovascular risk factors and things like that. And then here's the specific clip where I asked Dr. Ford about keto and heart disease risk, and he kind of talks about the research behind that and provides some other interesting details. So check those out as well. Thanks for watching. I'll catch you next time.